Hi everyone, welcome back to another session with Dr. Lorraine. I have a patient here named Koji. He presents today with some low back pain after being at the gym. Koji, tell me how you hurt your back.
I was actually putting a squat bar back onto the rack and it was too high. So I lifted one side to get the other side up and then the other side. And then after I went down, my extreme lower back was just extremely tight.
Okay.
And it was really painful at the time, but then it progressively got more painful where I could not even get out of my car, couldn't get in my car, couldn't walk. And it was very excruciating.
Okay, so a couple of questions. Does it feel worse when you bend forward or when you bend backwards?
It felt worse when I bent forward.
Bent forward.
Mm-hmm.
And now, do you feel worse when you're sitting or when you're standing?
I feel worse when I sit for too long.
Sit for too long.
Mm-hmm.
How about the transition from sitting to standing?
That's not so bad.
That's not so bad.
Not so bad.
Okay, and how long ago did this happen?
This happened about a week ago.
A week ago. Is it getting better?
It is getting better.
It is getting better progressively.
Yes.
Does anything go down the legs? Any numbness or tingling or pain? Anything shoot down the legs?
No.
No. Okay, great. Okay, so with a patient like this, the first thing I'm going to do is palpate, which means feel his low back. I'm going to start in the middle back because a lot of times other areas of your spine will be associated. Let me know what is tender when I poke. Anything?
That tender.
Right down low. So this is the area of the lumbar spine. Where he's feeling pain is in the area of the sacroiliac joint. Go ahead and lay on your back for me a second if you don't mind. Okay. Does anything hurt when this leg comes straight up?
No.
No? Bend the knee. Anything hurt when I do this?
Slight pinch.
Slight pinch in that area? How about this side?
No.
Okay, bend the knee. Anything?
Same slight pinch.
Slight. Okay, come on up for a minute, please. Okay, and stand up in front of me if you don't mind. Turn your back to me. Does anything hurt when I do this?
No, that feels good.
That feels good. Anything there?
Nope.
Okay, I want you to bend forward, slide down your legs, and then come back up. And I want you to do that about 10 times. Until
Much tighter.
Much tighter. Come on back up. And then keep going. Give me about 9 of those. What I'm doing right now is assessing him using a McKenzie assessment to see if he has actually deranged a disc. Tell me if that pain is getting better or worse or staying the same or starting to shoot into the buttocks further.
It's not getting worse
Okay.
because it's stretching.
Okay,
I
keep
feel
going.
like it's stretching,
Okay.
but no shooting pain into the buttock.
No shooting pain. Give me a couple more of those. Okay, and back up. And one more. No increase. Okay. Put your fists right here in your back, and I want you to lean way back and really push. And come on back up.
I feel that.
You feel that, okay? And keep going. I want you to tell me if that makes it better or worse.
I feel as if it's making it worse.
It's making it worse. Okay, that's enough right there. So from assessing Koji, we see that it's probably not the facet joints, which are part of the lumbar spine. It's probably the sacroiliac joints, which makes sense because that's probably what he did by leaning back and jamming his low back. Turn your back to me. Okay, now I'm going to see if his sacroiliac joint will actually flex. So go ahead and bring this knee up towards your chest and back down, okay? Now do it with the opposite one. Okay, and back down. Now stand on one foot for me and just keep it there. Okay, and switch sides. A little harder on this side, huh? Okay, and here I'm just looking for a little gluteus medius weakness, which can also contribute. Okay, go ahead and lay on your tummy. We're gonna actually treat him. And what I'm gonna do for treatment with Koji right now is just a little bit of hypervolt just to loosen him up. And then I'm gonna adjust his low back. And then because this injury is still pretty fresh and because he's still got some inflammation, we'll probably use some Biofreeze afterwards to get rid of some of the inflammation. So he's feeling it right in here mostly, right? It's always nice to loosen up the muscles a little bit. Makes my job easier, and it feels good to the patient too. Okay, Koji, I'm going to just have you stay right there. I'm gonna start with like a little drop with him. Check his leg length first to see if there's a change. Scoot down towards your feet a little bit. Okay. Looks like he's got a little shortening in the left leg, so we're gonna drop on this sacroiliac joint. You okay?
Yes.
Koji has never been adjusted before, so this is going to be interesting to see how he fares with this one.
Not bad.
Did you? And his leg length is almost back to normal. Okay. All right. Now I want you to roll on your side and face me this way, if you don't mind. I'm just gonna reach in here a second. Okay. Keep that bottom leg straight. Bend this leg, like that. Let me see this arm. There we go. You all right?
Mm-hmm.
Okay. And just like that. I'm gonna scoot you towards me. Okay. Keep that foot hooked right there, okay? Okay. Take a deep breath in and let it out, and let your knee just relax. There we go. Other way for me. You okay?
Yeah, but
Okay, straighten that leg, bend here. See this here? Let me have this arm. There you go. Very good. Okay. Let me see this arm for a second. All right, just leave that right there. Okay. All right, take a deep breath in and let it out, and let your leg relax. There it is. All right, come on up. Let's see what you feel like. You want to stand up and let me see how that feels? How's that feel?
I feel much better.
Much better? Okay, try to bend backwards. See if that made any sort of difference for you.
Yeah, I definitely don't feel the sharp pain
Good, good,
as if it was when we first started.
good.
Mm-hmm.
All right, awesome. Now I'm gonna spray his back with some Biofreeze because there is some inflammation, and Biofreeze will actually get in there and cool the area and help decrease some of the inflammation. So turn around for me. Now the only thing is, you do not want to touch your back and then touch your eyes, or touch your back and then go to the bathroom, because it's gonna burn, either one of those places. So just a heads up, okay? And this will start off a little wet, and then it'll get nice and cool, and it'll start to ice down the area. Biofreeze comes in spray, roll-on, and gel that you can rub on yourself.